Welcome to this edition of the eClinicalWorks podcast. I'm Adam Salati, and on this episode, we're helping to celebrate Health Center Week, where the focus this year is how health centers are chemistry for strong communities. Now, today we're going to be speaking with Lizbeth Cobb, who is the manager of EHR optimization over at Mountain Park Health Center. Lizbeth, thank you so much for taking the time to be with us today.
Yes, thank you for the opportunity.
Now, Elizabeth, before we get into the conversation, why don't you tell us a little bit about Mountain Park Health Center?
Mountain Park is in Phoenix, Arizona, and we have 8 main clinics throughout the valley with a couple of school-based clinics as well. And we are a multidiscipline organization. So we service anywhere from adult medicine to pediatrics, women's health, dental. So we have quite a bit of disciplines within the organization.
Now, over the last year, Mountain Park Health Center has helped to strengthen the community by using technologies like contactless check-in, post-visit surveys, and online appointment booking as catalysts to improve care delivery. So what kind of impact have you seen from these efforts?
We have seen a significant amount of benefit by implementing some of these efforts. One of them is the decrease in our no-show rate. We're currently at about a 6% no-show rate for patients that are using our contactless check-in text functionality. We've also implemented online vaccine scheduling. And with that rollout, we've seen patients start to utilize this ability to schedule their own appointments online as well. And now we're improving the information collection by working with analytics and seeing how these efforts are reducing staff burden and providing more accessibility for our patients to schedule their own appointments.
Now, with your patient population, obviously very vulnerable in many cases, what kind of expectations did you have for the adoption of these technology forward engagement tools?
We did have a goal to allow patients to utilize some of these technology tools to their benefit. We turned on contactless check-in, and 40% of the patients that were receiving this text were able to start using it without any intervention internally. Our check-in was basically to allow patients to feel comfortable to check in from the comfort of their own home, cancel their appointments with a click of a button. So those were the goals that we were hoping to reach by implementing this particular feature.
Now, how are you planning to reach the remainder of the patients who do need some sort of intervention?
We're planning to get our marketing team involved. We plan to add more information on the website. We do have the appointment widget that's on the website, so we want to make it more marketable and more visible to our patients. And we're also using our custom campaigns, the messenger feature that we have in eCW, in our EHR system, to be able to promote more of these functionalities to our patients.
Well, one might think that a global health crisis is a less than ideal time to try new things. So why turn all of these features on when you did?
With the pandemic, we noticed that some of the screenings that we were conducting on a regular basis were much lower for some of the particular items that we used to collect, such as SOGI, any type of social determinant of health questions. We were almost at a 0% for 2020. But then they changed the process by now capturing some of this information electronically. And the other thing is, with the contactless check-in, we're also able to target a specific discipline with a really high no-show rate on a monthly basis. For example, our dental departments had about a 44% no-show rate. And since then, we've seen that decrease to about an 8% rate of no-shows. So we're really trying to utilize these features to improve not only data gathering, but accessibility to our patients.
Well, it's quite a dramatic reduction there in the no-shows for your dental services. But, of course, no matter what we do, some no-shows are inevitably going to happen, which, many practices might see as a drag on their ability to connect with patients. But you actually found a very innovative way to turn those no-shows into an opportunity to improve services. Tell us about that.
Yes, so in the last several months, we've seen that the analytics for our no-show campaign has grown significantly. We have quite a bit of information on there. We can identify which patients didn't show up, which patients actually scheduled their follow-up appointment from that. Now, we also are going to be implementing the post-survey campaign functionality, which will now allow us to query these patients that did not show up for their appointments and find out what are the reasons that are preventing them from attending their appointment or keeping their appointment. So we are going to be implementing that in the very near future. We currently use the post-visit survey for our medical legal services, and that allowed us to identify opportunities to follow up and follow through with some of these services for our patients. And we've also been able to modify our workflows to allow this survey to go out to patients once the services have been rendered. So we want to apply the same concept to our no-show campaign and target some of those areas and see if there's opportunities that we can put in place solutions for them to keep their appointments.
How else are you utilizing surveys throughout your care process?
We rolled out a survey with our first phase of contactless check-in. So those patients that had confirmed their appointments or even canceled their appointments through the text, we were able to send, because the status changes at the time, we were able to send a survey through our marketing platform and query those patients on how they felt about this new feature. And we had a very good response rate from patients saying how much they appreciated the ability to just cancel their appointment at a one-time click, confirm their appointment a day before, remind them, a day before. We've also enabled the back office questionnaires too. So when the patient's checking in through the text message, they're now able to answer questions in their comfort of their own home, like I mentioned earlier. Social history, social determinants of health, that includes our SOGI questions in there. And we're actually in the middle of rolling out a COVID vaccine questionnaire as well for our patients.
You've innovated by allowing patients to book their own appointments using healow open access. How has giving patients more control over their appointments helped you to improve the quality of care and your ability to serve your community?
We've been able to provide patient autonomy. So patients have the ability to select their own appointment date and time. I think it also provides them a sense of safety that if they do check in through the contactless method, that they don't have to wait in line in a waiting room. They can just check in from their car and then be called back when they're ready to be roomed. It also gives them a sense of comfort and ease. And a lot of this is based on the responses that we did get back from our patients. We've been using the online or open access functionality for our pediatric facilities for several years now. And since we opened the urgent care model for our COVID vaccines, we've seen how it allows new patients to schedule and reserve a time slot for their vaccine appointments. We set it up for reservation blocks, so any new patient can still schedule their appointment, and then we call them to complete the registration piece at that time. We're also allowing for direct booking for our established patients, and that gives them, again, the autonomy to just select their own dates and times.
So what are some of your next steps for continuing to strengthen your community?
Based on the success rate that we've had with our vaccine online scheduling, we are going to move forward with open access by the end of the summer for all our remaining disciplines to be able to allow our patients to schedule their appointments online. And we're looking at ways of enhancing the questionnaires or the medical forms functionality on the contactless check-in so we can expedite the amount of time it takes to room a patient. So we are very much expanding these new features throughout the organization through as many disciplines that we have.
Well, we look forward to hearing updates on how all of those rollouts go for you and for your patients. Lizbeth, thank you so much for taking the time to be here and speak with us today.
Thank you very much.
Well, eClinicalWorks is proud to be able to support health centers that continue to provide chemistry for strong communities as part of Health Center Week in 2021 and beyond. If you'd like more information about any of the topics that we've discussed here in our podcast today, you can check out my.eClinicalWorks.com. You can also speak with your strategic account manager to learn more. For the eClinicalWorks podcast, I'm Adam Solati, and be sure to check out our other episodes on iTunes, YouTube, and my.eClinicalWorks.com. For the eClinicalWorks podcast, thanks for watching.